Good afternoon, everyone. Welcome to today's webinar hosted by the American Academy of Pediatrics and healthychildren.org. Today we are discussing helping kids with moderate to severe eczema. I would now like to introduce our host, Dr. Jennifer Shue. Dr. Shue is a practicing pediatrician, author, and mom in Atlanta. She is the co-author of Heading Home with Your Newborn and Food Fights, a frequent guest on national and local television, radio, and web-based programs. She is the medical editor of healthychildren.org, served as the Living Well health expert for CNN.com, has contributed medical information to Baby Center and WebMD, and serves on the Parents Magazine Advisory Board. Welcome, Dr. Shue.
Thank you so much for having me. I'm really glad to be with everyone today to talk to you about how you can help your kids with moderate to severe eczema. As you know, eczema can be very frustrating for both children and their parents, especially when the itching makes it really hard to sleep. And that's why I'm so glad to introduce our guest speaker today, Dr. Sheilagh Maguiness. Dr. Maguiness is Director of Pediatric Dermatology at the University of Minnesota in Minneapolis, and an executive member of the Society for Pediatric Dermatology and the American Academy of Pediatrics section on dermatology. She's a mom to 2 boys and is originally from Canada. Thank you so much for being here, Dr. Maguiness. And let's get started with our first question. So I think the best place to start is with the basics. Dr. Maguiness, what exactly is eczema?
Well, thank you, Dr. Shue. And before we jump in, I'd just like to say thank you to healthychildren.org and to Dr. Shue for having me on today. Caring for children with atopic dermatitis and their families is a real passion of mine, so I'm just really delighted to be here. I do think that the best place to start is at the beginning, and explaining what eczema is can sometimes be complicated. Eczema is also called atopic dermatitis, and for the rest of the discussion, I'll be using those two terms interchangeably. It is the most common inflammatory skin condition of early childhood. And for all those parents out there struggling with children with atopic dermatitis, know you're not alone. This is super common. Eczema affects about 10% of kids. And while we don't have a perfect cure for eczema yet, we have come a long way in our understanding of both what causes eczema and how to manage it. And so we can treat the condition so that your child's symptoms improve.
So what exactly does cause eczema then?
Well, Dr. Shue, 10 years ago, I could not have answered this question. We have really come so far in our understanding. It turns out that eczema is caused primarily by problems with the skin barrier. And I explain this to all the parents who show up in my practice. Children with eczema seem to lack or are missing in a protein that's expressed in the top layer of our skin. That top layer of your skin is called the stratum corneum. Super important. A protein that exists in the stratum corneum is called filaggrin. And it turns out that children with eczema are missing or deficient in filaggrin in that outer layer of the skin. This is so important and has led to a better understanding of not only eczema, but basically all allergic diseases because we understand the function of filaggrin. Filaggrin coats itself, it surrounds itself with water and draws water into the skin. When you have enough filaggrin, the pH balance and the moisture level of your stratum corneum, that top layer, is, the way it's meant to be. When you don't have enough filaggrin, you're losing too much water from the surface of the skin, and that has a lot of downstream consequences. Number one, the dry skin feels itchy and you tend to want to scratch and itch, but also your imperfect skin barrier is having then a harder time keeping out bacteria, allergens, and other irritants. And so that's a great explanation as to why eczema and allergic disorders tend to run in families, because that protein is certainly an inheritable trait. And so there's a complex interaction between children who are predisposed to eczema and the role of the environment. But now we can primarily say, and I think this helps everyone understand, that eczema is a disorder of the skin barrier.
Excellent. Thank you for that explanation. Here's another question that I get a lot. Is eczema contagious?
No, eczema itself, atopic derm, is not contagious. But because of that skin barrier abnormality that we just talked about, children with eczema are much more prone to skin infections. And so, from bacteria or viruses, that skin barrier can definitely be more prone to those germs that live on everyone's skin, but can overgrow when the skin barrier isn't perfect.
Excellent. That's good to know. What does eczema look like? How would a parent know if a child has eczema or not?
That's a great question. And you know what, Dr. Shu? It actually varies based on age. So eczema starts to show up in infancy around 3 to 5 months, and it tends to show up on extensor, like the outer areas. The cheeks, the outer arms, the scalp tend to be the first sites affected, especially the cheeks. At this time, it can really look bright red. It can be scaly, dry, sometimes weepy. In children with skin of color, it can be a duller red or maybe sometimes a little bit purple looking, and sometimes have pigmentary changes like hyperpigmentation. As time goes on, in school-age children, the eczema tends to localize to other really common areas. And those include the creases, actually, the creases of the arms, the backs of the legs, and then also the neck and the face tend to get more affected around school-age time. The eczema lesions themselves at that point look a little bit duller in color, not so acute or red or weepy. You can sometimes see scratch marks. The skin might look thickened and scaly. And again, in skin of color, that hyperpigmentation can definitely be a prominent feature. One of the hallmarks of eczema, you almost can't make the diagnosis without this, is itch. Itch is one of the main symptoms, and it can be pretty severe. Even children that have a little bit of itching can be, distracted, have sleep disturbance, and itch can really interfere with daily activities. So it's really important to get that itch under control as part of our holistic approach to treating atopic dermatitis.
Excellent. That's great information. So, what are some of the best ways to take care of a child's skin with eczema?
It all starts with a really good, gentle skincare routine. Optimizing your gentle skincare is super important, and having a daily routine that you can do is great. And here's what I usually recommend, and what many dermatologists have been recommending for decades. And I want parents listening to think about this when you're bathing your child. Think of soak and smear. This is often a mantra that I have parents repeat with me. You need to soak the skin and smear. You're soaking the skin to kind of get the water back into the stratum corneum. So we do recommend a bath, a tub bath, a soaking tub bath every day. I find this is best done in the evening, as part of the bedtime getting ready routine. You just use lukewarm water, not too hot. You don't need soap if you are doing a soaking tub bath every night, but if you do need something for, very dirty or soiled areas, a hypoallergenic cleanser, fragrance-free would be ideal. And you don't need that every night. After soaking, you want to get out, pat the skin dry, leave a little water on the skin, and then, if you have been prescribed any topical medicines, or you might be using an over-the-counter topical medicine, that would be the best time to put it right on the affected areas. After you apply the topical medicines, a thick moisturizer smeared head to toe to lock in all that great hydration is really important. And for pediatric dermatologists, we love thick moisturizers. Under 1 year of age, I really think that ointments are your main go-to, like petroleum jelly or a similar kind of greasy petroleum-based moisturizer. And then, later on in childhood, a cream-based moisturizer, one that you have to take the top off the jar, dig in, and get all over. Typically, we recommend avoiding lotions. They tend to be thin, from a pump. We prefer the thicker for the soak and smear technique. And then just remember to keep the fabrics that you're using and you're dressing your child in breathable. Cotton, other fabrics like polyesters or synthetics can sometimes be a little irritating or trap the heat. And keep it simple. Try to lean towards fragrance-free things. Try to avoid fabric softeners and extra things that aren't needed, like bubble baths or bath bombs and things that could, potentially irritate that dry, sensitive skin.
I love your description of soak and smear. I think that's a good visual aid for parents. and to put the moisture on in a thick layer. One other description I've heard from a dermatologist is to frost that skin like a cupcake. And so that's something
Yeah,
that I think everyone can picture in their own head. So, and especially for something like diaper rash, frost it like a cupcake. Um,
exactly.
so let's talk about the itching that you mentioned. How can we help kids stop itching?
That is a great question, and it can be a little bit complicated. Since the itch from eczema is really multifactorial, it's because of the dryness, it's because of the inflammation. And then when you see those little fingers digging in and, making the lesions worse and, crusted and weeping, it's kind of like this vicious cycle. The itch, makes the scratching makes it even more itchy. So, really, it's all about that skin barrier repair. I always tell parents we need to address all four of the signs and symptoms of atopic derm at the same time. So, dryness, itch, inflammation, and then that tendency for skin infection. Other basic things other than that soak and smear method, which can really help, and using your medications when you've been prescribed, keep the nails short. Sometimes wearing cotton gloves or a onesie that's a little bit longer can help keep those hands off the skin at night. And then just obviously, it's so hard for the kids not to scratch, almost impossible actually. So lots of compassion and praise and just really supporting them through those times. Some families actually like to do cool compresses or ice packs. Anything you can think of that helps your child would be appropriate to try. When it's really severe and it's nighttime and you think you need something extra, a sedating antihistamine like diphenhydramine can sometimes help as well, cool down that itch and maybe help your child sleep a bit better.
Thank you for that information. What about flare-ups of eczema? Some parents complain that their child's skin gets worse in the summer, but then I also hear that some kids get worse in the winter. How would you treat these flare-ups?
That's a great question. And I do think there are two separate cohorts of kids that flare in the summer with the heat and the humidity and the friction really exacerbates their skin. And then we have those that flare in the winter, just like you mentioned, where the low humidity and the dryness really kind of flare it up. But there is one great way to cool down a bad flare quickly and safely, and that is with wet wraps. So I want to tell you exactly what to do with wet wrap therapy. So, for younger children, you can actually take a pair of their cotton pajamas or a onesie. You can dampen it with warm water, wring it out so that it's damp, not dripping wet. And then after soak and smear, you do your bath, you put on your medications if you have them, Vaseline or petroleum-based moisturizer. Then you can put that damp onesie or PJ set on, a dry one over top of that. And if your child will tolerate it, it is perfectly safe and effective to leave it on overnight. Some kids actually find it soothing and cooling, but even for a couple of hours, it is helpful. Really, really safe and effective way to cool down a flare quickly.
I think a good point you make is to make sure that the child's room is warm, because if they're a little bit wet and cold, that might be uncomfortable.
Yep,
What
sometimes an extra blanket can help.
good idea. What about eczema triggers? Are there common triggers that cause eczema in most kids, would you say?
I would say yes, because that skin barrier is, not perfect at keeping out allergens, and allergic conditions tend to run together, like allergic rhinitis, food allergies, asthma. They can all have triggers, and so I think environmental allergens, pollen, dust mite, dander, smoke, all of those things can really irritate and might lead to flares in some cases. Certainly overheating, heat, sweat, friction, all of that, fabrics that are scratchy or synthetic, leading to a little bit more overheating, those can all flare up eczema. Um, in rare cases, certain foods might cause a little itching. But if you think this is the case, definitely talk to your doctor before trying any restrictive dietary changes, because in the vast majority of cases, a food is not the cause of eczema, but certainly they are, food allergies and eczema are related.
What if a child can't avoid some of these triggers? Are there some medicines that can help once the eczema, t- you know, sets takes place?
Absolutely. So when you see that eczema on the skin as red, thick, crusty, that is really actively inflamed skin. And that inflammation needs treatment. And the mainstay of treatment for atopic dermatitis is topical steroids, topical cortisone medications. They really can do a great job of being applied right to the skin to heal the inflammation and irritation. Typically, we would recommend low or mid-potency topical steroids, and those are mostly available by prescription from your doctor. But there is 1% hydrocortisone ointment over the counter for more mild cases, and that is applied to the skin after bathing to the affected areas right before you put your moisturizer on. Most pediatric dermatologists prefer ointments, the greasy ones, the petrolatum-based over creams, but your doctor will definitely point you in the right direction in recommending a treatment for your child's skin. And I just want to say that when we use the topical steroids to put out that fire, put out that inflammation, and we need them for, hopefully shorter periods of time, they are extremely safe and effective, and we almost never run into trouble with any side effects. And then, like we mentioned, certainly at nighttime, especially if itching is a problem, antihistamines that are sedating, like diphenhydramine, can be helpful. They can definitely help your child sleep a little bit more easily, and sometimes even, help them tolerate the wet wrap therapy a little bit better. So that can definitely be helpful. And then there are also a lot of newer tools in our toolbox, Dr. Shu. So there are some non-steroidal anti-inflammatory medications that we use really regularly. One is called tacrolimus and the other is pimecrolimus. Those two are non-steroidal anti-inflammatories that you can be used, in conjunction with the topical steroids or to give your skin a little break from the steroids, or if you need them longer term on sensitive areas like the face or the skin folds. Even newer is a phosphodiesterase inhibitor called crisaborole, which is also available only by prescription and can be helpful in mild cases. And then I am really excited to tell you that for the very first time, we have a biologic therapy that is effective and FDA approved for treatment in children. That biologic therapy targets the exact part of the immune system that is leading to the inflammation that we see on the skin in atopic dermatitis, and it's called dupilumab. And it can be very, very helpful in children with moderate to severe eczema who just are continuing to flare and not responding to traditional therapies. So it's great to have new options.
Excellent. Thank you for the new options. I had not heard of some of those. So really good ideas for parents to talk with their pediatrician or dermatologist if they feel like they really just can't get their child's eczema under control. The next question we have has to do with skin infections. So you talked about keeping the nails short, hands clean, but skin infections can still happen from all that scratching. So how can parents help their kids avoid getting infections?
That is a great question, and I'm so glad you asked because actually, one of the most favorite tools that I have in my toolbox really does address this idea that the children with atopic derm have more bacteria on their skin to begin with because of their skin barrier defect and are more prone to skin infections like impetigo or that kind of crusting that can happen and make their eczema worse. And a great helpful way to reduce bacteria on the surface of the skin is a swimming pool bath, a dilute bleach bath. And in fact, I recommend them for all ages, even infants. And it's an integral part of how I treat eczema and optimize that topical therapy. So here is how you would do a bleach bath. So in a soaking tub bath in your home, you would, fill it up 4 to 6 inches of water like you would typically do. Household bleach is widely available. You would take half a cup of plain bleach or 1/3 of a cup of concentrated bleach, add it to that full bathtub, swirl it around, and you're ready. Now, it's really important that the right type of bleach is used because it turns out that bleach has gotten very fancy over the past few years, and there are lots of scented, splashless, and fabric protecting varieties available now that would not be good to use in a bleach bath. You have to make sure that the bleach is plain, generic, and it just says sodium hypochlorite, which is the active ingredient in bleach. And it's so helpful. Um, a lot of moms are a little bit concerned or hesitant about, discussing and talking about a dilute bleach bath. Um, but when you step back and think about it, it's no different than taking your child to a swimming pool, swimming lesson, or a splash pad. All of that water is chlorinated and has other chemicals aside from the bleach. You're just doing it in your home in a controlled way to help reduce infection. Kind of like trying to peel off that layer of bacteria that might be getting in between the medicines working and the moisturizers doing their thing. So definitely important to supervise closely, have a well-ventilated space, and soak for about 10 to 15 minutes, and that can be part of the soak and smear.
Excellent. Thank you for that great information. For those of you who are asking for that name of the biologic again, we'll put that in the chat box. It's dupilumab, and that'll be in the chat box. The next question that we get a lot is, do children outgrow eczema? What do you say, Dr. Maguiness?
I say yes. I say that there is probably, 2/3 of kids will improve and we will start to see reduced signs and symptoms by mid-childhood. So around 4 or 5, you're starting to see a little bit of that less acute eczema. And they typically do get better. They may still have a tendency for dry, sensitive skin as they grow up. Um, but then there is 1/3 of patients that are more severe and that will continue to struggle with active flares of atopic dermatitis throughout adolescence and even later. So there is a cohort that will still have eczema as adults.
And that leads to another common question, which is, when can parents stop treating a child's eczema rash?
So after you have optimized your topical therapies and you've done the soak and smear, you've been really intentional about how you've gone about it. We've done our baths, we've done our topical cortisones, we're doing our moisturizer, we're doing bleach baths. All of that can be tapered. So, for example, once we've done that intensive therapy, we can reduce the amount of topical steroids we need because the skin barrier has probably healed and we're not going to see those red, actively inflamed patches any longer. And when the skin barrier feels hydrated and moist and we don't really need the bleach baths any longer, we can reduce the frequency. But I generally tell families that it is really soak and smear is going to be in your foreseeable future. So you always want to keep the skin barrier health in the center of your mind. And when you start to see symptoms ramp up, you can restart the more intensive therapies. But a daily bath and a moisturizer is really key and probably shouldn't be stopped, or else you would be at risk of more flares.
Yeah, I think I see that the opposite question a lot. Parents tend to want to delay treating a skin rash with steroids. And I like to tell them that if you catch it earlier, it's much easier to treat so that in the long run, you're actually limiting the amount of steroids, cream or ointment that your child gets. Would you say that's also the case?
I would say that that is 100% the case. I will always counsel, use it now up front and use it like you mean it. Really get ahead of that inflammation so that you're not chasing it. Get out in front so you can take longer breaks and use less of the steroid over time because of course that's our shared goal as, the parent and physician is to use the least amount of medicine that we possibly can.
Thank you so much for that. We have gotten lots of questions from our attendees, which is great. So keep those coming. One question kind of ties into what you were talking about steroids. A lot of times parents will hear about side effects from steroids. Are they safe for children? Are they safe for babies? Are there certain parts of the body where we need to avoid steroid medicine?
This is a question that gets asked all the time. And the vast majority of the answer is going to be yes, absolutely. The topical steroids are perfectly safe. In general, because we know we're going to need these medicines, on and off, we are not prescribing the ultra potent steroids that can get into trouble with thinning the skin and other things. We're using low to maybe even mid potency topical steroids, the lowest that we can to control the disease. And so in the vast majority of cases, we can use them very safely effectively. And the hope is intermittently, that we don't need them every day because we've got our other tools, soak and smear, a bleach bath here and there. So yes, the steroids are safe. And when used appropriately, they make
Are
all the
there,
difference.
thank you for that. Are there any special considerations for the face or around the eyes? That's another question that we get a lot.
Absolutely. So, short term, for up to 2 weeks at a time, topical steroids are perfectly safe for head and neck, around the eyes, and even, in the skin folds. If we start noticing that the pattern is, boy, this child has a lot of flares on the face, on the periorbital skin, that's when we can kind of lean on our non-steroidal anti-inflammatories like tacrolimus or pimicrolimus that can really help and act as kind of steroid sparing agents in those regions. So that's a great question. And we do have other tools when we need them for longer durations on sensitive areas.
You mentioned using kind of thick moisturizers such as petroleum jelly or similar. What about natural remedies like coconut oil? I get that asked that a lot in my practice.
Yes, I do too. And I would say that I don't really have a problem with the natural moisturizers like coconut oil and specifically sunflower oil in terms of skin barrier repair. But, certainly I don't think you can beat the plain petrolatum for forming that thick hydrophobic barrier and preventing the water loss. But, if it's a mild case and due to parental preference, a natural moisturizer like sunflower oil or coconut oil is preferred, I think that that could work.
Excellent. Thank you for that. What about kids who have lighter areas of skin once the eczema has healed? And I get this remark a lot, especially from parents of kids with darker skin, where once the eczema is gone, it looks a lot lighter as the skin is healing. Is this long-lasting change in color? Is there anything that can be done to prevent it?
So that's a great question, and it's super common. So, especially in skin of color, when there is a little bit of active eczema, say on the cheeks, you can often see oval areas of lighter pigmentation or hypopigmentation. We actually have a name for it. We call it pityriasis alba. And it's a sign that there has been some active inflammation in the skin. A lot of parents wonder, are we doing something that is, having a bleaching effect? That's actually not the case. The inflammation itself is interfering with the pigment production. So, really, again, it goes back to let's treat for any dryness or inflammation on the cheeks or other areas where the dyspigmentation is occurring with the moisturizers and topical therapies, and that will help restore the pigmentation over time.
That's very good to know because I know it's disconcerting when you see that change in color. Okay, let's move on to allergies. You mentioned a little bit about allergies earlier. What about testing a child for allergies, either blood tests or a skin prick test?
So, for food allergies specifically, it's kind of a complex relationship, because the food is not causing the actual eczema, yet children with eczema are more prone to have food allergies. And so, if you think your child has signs and symptoms of food allergies, such as vomiting, after a food or hives occurring after exposure to a food, that could indicate a true food allergy. And if so, the best way to make the diagnosis is definitely connect with your pediatric allergist or local allergist. And skin prick testing is the most sensitive way. Unfortunately, blood tests for foods just isn't very accurate. So, thinking about skin prick testing and establishing care with an allergist is a great way to address that.
Excellent information. Sometimes I'll have patients come to me and show me some rough bumps on the cheeks, on the outer sides of the upper arms or the thighs, and they're wondering if that's eczema. Um, it looks to me more like something called keratosis pilaris. Can you talk a little bit about that type of rash, and are they related to eczema?
Yes, absolutely. So keratosis pilaris, KP, is really common and it's a very innocent condition, but definitely parents notice it and bring it up. And so exactly right, you get these small kind of follicular bumps that are a little bit scaly or rough on the cheeks, outer arms, and thighs. And KP, keratosis pilaris, is not the same as eczema because it's not caused by inflammation in the skin or a poor skin barrier. It really is something different altogether. So it's not going to respond to, say, topical anti-inflammatories like a steroid or the others. It would really, be best treated with moisturizers or things that kind of help the keratin become softer and more supple. And there's definitely creams you can look for to have that effect if it's bothersome for the child.
Okay, I think we have time for just one more question. This comes from an attendee from Hawaii, and they would like to know whether they should use the air conditioner to keep their child cool all day to prevent worsening of eczema.
That is a tough question to answer. I mean, I think that we did discuss that we have that cohort of children who do better when it's cool, and then we have those who do better when it's warm. So I think it really depends on the actual child and the pattern of which their eczema flares. Certainly, if heat and friction are an issue, then keeping the environment a little bit cool, maybe doing some wet wrap therapies, and definitely continuing with the soak and smear. All of those things can be helpful.
Thank you so much for that information. I'm going to pass the microphone back over to our host, and we will wrap up this presentation.
Thank you so much.
Well, thank you to both of you, Dr. Shu and Dr. Maguiness, for all of that great information. Just a reminder to all of our participants, you're invited to register on healthychildren.org, and you'll receive our e-newsletter, a personalized homepage, and special offers. And don't forget to follow healthychildren.org on Instagram, Facebook, Pinterest, and Twitter. We hope you enjoyed today's webinar, and we ask that you keep an eye out for a quick survey. Please let us know what you found most helpful and any suggestions you may have. And a special thank you to our sponsor, Sanofi, Regeneron, and Genzyme, who we're about to show here. And thank you again for joining us, and have a great day, everyone.